Today I'm with Phoebe interventional cardiologist Dr. Russell Jones to talk about heart health and automated external defibrillators. First, Dr. Jones, what's the difference between sudden cardiac arrest and a heart attack?
Well, a heart attack is damage to the heart muscle, usually from decreased blood flow, created by, a majority of the time, blockages from cholesterol, plaque, and buildup. Cardiac arrest can be accompanied during a heart attack, but fortunately most are not. Current data would suggest a 5 to 11% can be associated with cardiac arrest, but a cardiac arrest is predominantly an electrical problem, which then causes the heart's pumping function to be very inefficient and not meet the demand of the body, leading to sudden death. So people can have heart attacks without cardiac arrest, fortunately, or people can have cardiac arrest, sometimes associated with heart attacks, but not always.
So what can cause a sudden cardiac arrest?
Well, majority of the cases that we think of are heart attacks. Again, about from 4 to 11% based upon current data. Other medical conditions, such as a blood clot to the lungs, severe abnormalities of some of the body's electrolytes, electrocution, low oxygen, and occasionally, some of you may have seen on TV, injuries or contusions to the chest wall can precipitate a cardiac arrest.
So if we're with someone and their heart stops, they suffer a sudden cardiac arrest, what do we need to do right away?
Well, first off, assess the patient, assess the person. If they fall down, they're not breathing, call 911. Start CPR if you know how, or call for help. And if there is an AED available, that's an automated external defibrillator, get it as quickly as possible and follow the very simple directions that are actually audible on the device, as it can provide an electrical shock if indicated and be life-saving.
Yeah, so we've got one of those. This is an AED that we have here in front of us. So even if I have never been trained on this, I should not be afraid to use it, right?
No.
So what do I do?
Well, first thing, always turn it on, and it will provide instructions.
Apply pads to patient's bare chest.
And the pads.
Plug in pads connector next to flashing light.
And there's pictures on it where to place those pads. And that is it. It will then tell you whether or not it will provide a shock or to continue other medical treatment, usually CPR. And it will tell you when it can provide a shock based upon the rhythm it is analyzing.
So it's very simple to use even for a layperson who has no training whatsoever.
Very simple, designed to be very specific, very simple, instruction-oriented, and life-saving.
So let's talk about heart attack now. What are the primary symptoms of a heart attack?
Well, classically we think of heart attacks, chest pain, unusual shortness of breath, discomfort, some describe it as a pressure, some describe it as pain. It can radiate into the neck, the jaw, the arms, more so the left arm compared to right. It can be associated with dizziness, nausea, vomiting, sweating, and unusual shortness of breath generally.
I know often when people start having some of those symptoms, they may try to convince themselves they're not having a heart attack, that it's just something else. If we have those symptoms, what do we need to do?
If those symptoms are new, you've never experienced them, they are lasting more than a few minutes, I tell people don't try to drive themselves to the hospital if they think they're having a heart attack. Call 911. Paramedics can provide life-saving triage and in certain instances may be able to phone ahead to the hospital to let them know what is ongoing with the patient.
And I'm sure you would rather see someone at the hospital and tell them it's okay, you're not having a heart attack, rather than them suffer that heart attack at home thinking it's something else.
Every time. I don't want to see someone writing out their heart attack at home. Come to the hospital, get checked out. That happens in the emergency room. If you need advanced care, that's what we're there for. And if we can reassure you that everything is fine, we'd rather do that than you trying to figure that out at home.
So what is your best advice to help us maintain good heart health?
All right, number one, if you smoke, stop smoking. Stop smoking and stop smoking. They're top three. And then other things that we think about, one is if we have other medical conditions such as diabetes, high blood pressure, high cholesterol, make sure those are well controlled with medications following your doctor's advice. Third is lifestyle, and that's on us. In addition to stopping smoking or other nicotine products would be exercise and diet. We shoot for exercise of a mild to moderate intensity for about 150 minutes a week. That can be as simple as walking, which can be life-saving. It can prolong our life and reduce the incidence of having a heart attack. Same thing with diet. reducing the amounts of sugary foods or highly refined carbohydrates in our diet, that being processed foods, pre-made foods, fast food in general. Those are some of the best steps we can do to minimize our risk of heart attack and improve our cardiovascular health.
That's great advice. Dr. Jones, thanks for sharing your expertise with us today.
Thanks for having me.